mean arterial pressure. Before entering into this session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. Let's get into the session. What do we mean by mean arterial pressure? Mean arterial pressure is the average arterial pressure throughout one cardiac cycle. Cardiac cycle is defined as a sequence of alternating contraction and relaxation of the atria and ventricles in order to pump blood throughout the body, which means systole and diastole. Now, how to calculate mean arterial pressure? For calculating mean arterial pressure, we should know the blood pressure of the patient. Let's discuss this with an example. For example, blood pressure of the patient is 120/75 mmHg. Second is, we should know what is systolic and diastolic pressure. The first number, 120, is called the systolic pressure. Systolic pressure measures the pressure in the arteries when the heart beats. The second number, 75, is the diastolic pressure. Diastolic pressure measures the pressure in the arteries when the heart rests between the beats. So now it's clear what is systolic and diastolic pressure. The third step will be the formula. To make the formula more easier, remember the number 1, 2, 3. Remember, the word systolic, S stands for single, so systolic is multiplied by 1, plus diastolic, the letter D stands for double, diastolic is multiplied by 2, and this is divided by 3. So the formula is mean arterial pressure equal to systolic blood pressure plus 2 diastolic blood pressure divided by 3. And applying all into the formula, we get the mean arterial pressure is 90. This formula will be easier if we remember the number 1, 2, 3. When we have a look at this picture, the patient is on invasive monitoring of blood pressure. So here we can see the systolic and diastolic pressure as well as the mean arterial pressure. When the patient is on invasive blood pressure monitoring, it is easy for us to know the mean arterial pressure which is displayed in the monitor. But in case of non-invasive monitoring, we may need to calculate the mean arterial pressure by using the formula. Now, other formula for calculating mean arterial pressure. Let's use the same example and calculate the mean arterial pressure. Here the systolic blood pressure is 120 and diastolic pressure is 75. In this formula, we need to know what is pulse pressure. Pulse pressure is the difference between systolic and diastolic pressure, which means systolic pressure minus diastolic pressure. So here pulse pressure is 120 minus 75 equals 45. Now the formula for mean arterial pressure is diastolic pressure plus 1 by 3 multiplied by pulse pressure. Applying all into the formula, we get the mean arterial pressure is 90. Why mean arterial pressure is important? Mean arterial pressure is important because it measures the pressure necessary for adequate perfusion of the organs of the body. Normal range of mean arterial pressure is between 70 and 100 mmHg. It is vital to have a mean arterial pressure of at least 60 mmHg to provide enough blood to the vital organs such as heart, brain, and kidneys. When mean arterial pressure falls below 60 mmHg, it can lead to inadequate perfusion of the organs of the body, which may be caused by sepsis, stroke, hemorrhage, or trauma. As a result, the vital organs will not get enough oxygen perfusion and will become hypoxic, and this condition is called ischemia. Low MAP can be a life-threatening one. In case of high mean arterial pressure, the heart needs to work more than the normal level in order to push against the elevated pressure in the vessels. and this may lead to blood clots, heart disease, heart attack, and stroke. In case of low mean arterial pressure, the goal is to increase the blood pressure, which may be done by administering intravenous fluid, blood transfusion, vasopressors, etc. In case of high mean arterial pressure, the goal is to decrease the blood pressure, and which may be done by administering nitroglycerin and other medications, etc. In case of both low mean arterial pressure and high mean arterial pressure, it is very important to know the underlying cause and treat it accordingly, which is the ultimate goal. So, this is all about mean arterial pressure. Here we have some examples for you to practice. First example is patient's blood pressure is 145/95, and what is the patient's MAP? Second example is patient's blood pressure is 129/70, and what will be the patient's MAP? Third example is patient's blood pressure is 178, and what will be the patient's MAP? You can comment the answers in the comment section. If you find this video useful, please like it and please subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day. Hello everyone.